for joining us today. I'm Dr. Castelblanco, and this is Dr. Ruth Sepanian, and we are two of the pediatricians from the Facey Medical Group. And we're here today to just have a quick discussion on a topic that is very relevant right now, but also in all of pediatrics. We're going to talk about pediatric fever. So what we've done is we've compiled a few of the most common questions that we get from our patients, and we're just going to have a conversation about them and try and answer these questions for you to hopefully ease your fears about pediatric fever. But of course, if you have any further questions, please reach out to your pediatrician, as they are really the best person that knows you and can give you the most specialized information for your child. Dr. Sepanian, did you have anything else to say?
Well, it's an honor to be able to discuss fevers with everyone. And of course, if ever you have any questions or would love to reach out, we're always here for you. So thank you for listening. And if you need anything else, don't hesitate to give us a call.
Awesome. Perfect. So with that, we'll just go ahead and get started. So the first pretty basic question, what is a pediatric fever, or really what's a fever in general? And so we consider a fever a temperature of 100.4 or above. I think Ruth has a nice visual for us. So 100.4, that's a good cutoff to keep in mind. Above that, 100.4 or above is when we recommend treating the fever, or giving us a call when there's a fever so we can figure out what's going on. Below that number is not so bad. So that's the basics of a pediatric fever. Ruth, did you have anything to add to that?
Yes. Sometimes I hear patients and parents tell me, my kid's always 96 and now they're 98 and I think it's a fever. And I just want to let you know, sometimes that can happen. We can have sometimes variations in our body temperature, especially for babies. Sometimes, we love to wrap them up and swaddle them up with multiple blankets. And we can see those temperatures sometimes go up, close to 99, and everyone gets worried. So I just want to remind everyone to make sure that you're getting a good temperature, and sometimes we can see variations in our temperature that aren't quite at that 100.4 cutoff, and they could just be normal variations.
Absolutely. Very good point, Ruth. Thank you. All right, so our next question is, well, what causes fever? Dr. Sepanian, did you want to start on that one?
Yes. And this is a really complex question, because I feel like there's just so many answers to it, and we spend so much time trying to figure out the causes for our patients. So I always want to encourage you, if you do notice a fever, we'd always be happy to help out and determine the cause of the fever. The most common causes I would say that I see here in general for our pediatric population are usually infectious sources. So sometimes it could be like a viral infection, sometimes like the common cold that sometimes causes fevers. Other things like bacterial infection, sometimes like an ear infection or a UTI, these things can cause fever. And then of course, there are those inflammatory issues that can cause a fever. Sometimes we see something as simple as teething causing very low-grade temperatures. Other times we can see it with some rheumatologic etiologies. So it can vary, but I would say the most common cause for fevers that I see are usually kids who might have a cold or a viral infection. Any thoughts, Dr. Castelblanco?
Yeah, so I definitely agree with all of that. Fevers can be caused by a variety of infections and inflammatory conditions. It really just indicates that there is some kind of inflammation going on in the body, whether that's infectious source or a non-infectious source. So it's not always super simple to identify exactly what is causing the fever, but definitely, like Dr. Sepanian mentioned, give your pediatrician a call. If your child is otherwise looking pretty well, eating, drinking, not feeling too bad. Sometimes we can let it ride out at home without having to come in for a visit. But sometimes, depending on other symptoms, we will want to see your child in the clinic to really figure out where it's coming from. When we do a physical exam on the child to figure out where the fever is coming from, we look at several different places. So we, from head to toe, we look in the ears, we look in the throat, we look in the nose, we listen to the lungs, see if that's where it's coming from. One place where it is sometimes difficult to see, but we can test for it, is a urine infection. And of course, lots of other options there. But those are the places to keep in mind. So that definitely summarizes kind of where things are coming from. So good. So what is the best way to take a temperature? So I think I'll go ahead and start with this one. So the most accurate way to take a temperature, particularly in babies, is to take a rectal temperature. The more central of a temperature that we obtain, the more accurate it's going to be. I realize that getting a rectal temperature is not always possible, especially once kids are a little bit older. That's not going to be a comfortable way to take the temperature. Other good options include using an ear thermometer. If you just use the ear thermometer, that's another pretty accurate way. Or if you have a thermometer that goes underneath the armpit or in the armpit, that's also very good. There are some popular thermometers, including the thermometer that swipes over the forehead. There's other thermometers that use like a little infrared beam and is a contactless thermometer. So the one that swipes over the forehead and the one that doesn't even touch the skin, those are less accurate because now we're getting further away from the body's core body temperature. And so, but if it is looking like a fever, if it's 100.4 or above, any way that you take the temperature, whether it's rectal, whether it's in the ear, whether it's over the forehead, we believe you, give us a call, let's see what's going on, and we can determine what the best thing to do is. Any other thoughts, Dr. Sepanian?
Yes, I get a lot of parents who tell me, I took the forehead thermometer and it said 105 and then it said 102 and 103. And I find it that for some parents, it can be very, the results can be, like you mentioned, not as reliable. And it depends so much on the distance between the skin and the actual infrared scanner. So I try to tell my patients, try to avoid that one. It's just way too nerve-wracking at times. I do like the ear one. And that's the one that we try to use here in the office. And I recommend if parents are trying to look for a good one, if you can pick that one up, we'll be more than happy to show you what we're using if you're here in the office. And then in terms of the rectal thermometer, yes, I do think that's the greatest. And I have some parents who call and they say, we took the armpit temperature and it was like 100. Do I need to add a degree or subtract a degree? And I just go with what you get. And we believe it. You don't need to match a rectal thermometer reading. So definitely just go with the number you get, and hopefully you're getting a number ideally from like maybe the ear or underarm. Those would be my preferred locations to get a temperature from.
Yeah. Perfect. I will add one more thing, and I get this question a lot from parents. Do I need to take their temperature every day, especially in newborns? And you definitely do not need to take their temperature every day. You'll just freak yourselves out when you see the variations in body temperature. So if you feel like there's something wrong, like your child is feeling really warm, they're having trouble breathing, they are not eating very well. I mean, especially in a newborn that can't tell us if something is hurting them. If you're seeing signs that are concerning to you, that's definitely a good time to take their temperature. But I wouldn't do it routinely as it's not really needed.
Right.
So our next question is, are fevers dangerous? So I get this question a lot. And the answer is the fever itself is not dangerous all on its own. Like I mentioned earlier, the fever indicates that there's some kind of inflammation in the body. So it basically alerts us to the fact that we might need to go looking for where the fever is coming from, for what is causing the fever. But the fever all by itself, it's not dangerous. It makes kids feel pretty bad. Some kids don't feel too bad, and then other kids feel very sick when they have a fever. So that is one of the main reasons to try and keep the fever down, is just to keep the kids more comfortable. And when kids are more comfortable, they will be more inclined to drink their liquids, not get dehydrated, eat their food. It just makes them feel better. So that's why we like to keep the fever down, not because the number itself is something that is dangerous. Great. And again, and I know we've said this multiple times, but if your child does have a fever and it is something that is really concerning you, you can always give us a call. We have the on-call number that you can also call if you're really worried about it, even after hours, and we will talk you through what it is that we need to do about it. So perfect. So that brings us to, well, how do we treat a fever? And we'll get into this a little bit more extensively as we go along. But the main two medications to give kids for a fever are tylenol and motrin. So I'm sure you're all very familiar with both of those medications. They are over the counter. Less than 6 months old, it's only Tylenol. Once kids are 6 months old or older, then it is okay to use Motrin, but not less than 6 months old. And the dosing is based on their weight. And so when you get the Tylenol and Motrin over the counter, on the box, it will come with some recommendations for doses based on your child's weight. Those can sometimes be a good place to start. For the most accurate dosage, ask your doctor. It is based on your child's weight, and we can do a calculation and tell you exactly how much Motrin or Tylenol to give. One word of caution on the different kinds of Motrin I'll mention. There are the infant Motrin and the children's Motrin, and they are a slightly different concentration. So when you ask us for the dose, or when we give you the dose, we'll often ask you, are you using the infant or are you using the children? Just to be safe, I tell all my families to just get the children's of everything. Children's Tylenol, children's Motrin, because that is what we are most familiar with. And when we give you the dose, that's what we mean, is the children's Tylenol or the children's Motrin. These days, the infant Motrin, or sorry, the infant Tylenol and children's Tylenol tend to be the same concentration from what I've seen. So I'm not sure why there's a distinction these days between infant and children's Tylenol, but it's still just a safe bet to just get the one that says children's, so that when we give you the dose, it's an appropriate dose for your child. How does that sound, Dr. Sepanian?
It sounds great. And I just wanted to add one more thing. Another reason why I personally prefer children's Motrin as well is because I feel like the dosing is very similar to the children's Tylenol dosing. And I think that makes it a little bit easier to remember. How much am I doing? Is it 3 milliliters? It's a little bit easier to keep track of in terms of dosing as well, because it tends to be more similar to your Tylenol dosing. And one more thing I wanted to mention, just in case some of you are buying the generic brand, when we say Tylenol, we're essentially talking about the active ingredient, acetaminophen. So that should be what you're looking for, is acetaminophen as your Tylenol. And then when we talk about Motrin, we're talking about ibuprofen. And I know some other different brands, like you might see perhaps Advil or Excedrin. they usually do contain the same active ingredient of ibuprofen. So those are the two main categories, acetaminophen and the ibuprofen. Acetaminophen, which is usually your Tylenol, and ibuprofen, which is usually your Motrin. So those are the main groups that we use for our fever management.
Awesome. Thank you very much for that distinction. That is very important to keep in mind. So, Dr. Sepanian, when do we alternate Tylenol and Motrin, and how do you recommend doing that alternating?
Great question. And this is where I feel like the art of medicine comes into play, because there's really, I would say, if the temperature goes a little bit higher, and oftentimes people can have different thresholds for what they call like a higher fever. Some people call it anything above 102. Some people call it anything above 103. I find it that if you're above 102, 103, you might need to start alternating between the two medications. Sometimes it becomes harder to manage the temperature with just one medication. And that's when I suggest you might want to consider alternating. If you start seeing that you've been using one medication and you're still seeing, the fever is still there, the temperature is still 100.6 or it's 101, and it's just quite not going down further, that's when I would say we might want to start considering alternating between the two medications. One of the things I always want to make sure we bear in mind as well is that before you medicate, make sure you take the temperature, because sometimes you're just constantly doing this routine of using the medication and you're not quite sure when the last fever was. So it's always a good idea to take the temperature before medicating. And then oftentimes, what I like to do is if I see the temperatures are higher, suppose 103, 104, and we need to alternate, I usually suggest a minimum of 3 hours between the medications, ideally 4 hours between the medications. So what I mean by alternating, suppose it's noon and we use Tylenol. Well, the next time we could use another medication would be in 3 to 4 hours. So, like around 3 to 4 o'clock, I would say we can use Motrin. And then that's only if you're still seeing a fever. If you're still seeing a temperature of 101 or a temperature going on, that's when I would say we want to continue with the secondary medication. And then, so at 3 o'clock, suppose we give the Motrin, and then again at around 5:30, 6 o'clock, it's rolling around and we're seeing again another temperature of 101. That's when we want to resume our Tylenol. So what we did was Tylenol at noon, Motrin at 3, and then Tylenol again at 6 o'clock. And that gives us 6 hours between each respective medication, and it gives you a 3 hour gap between each different medication, so you can see how the body is responding and if the fevers are persisting. And again, I only try to do this for higher temperatures, and sometimes it can get confusing. So always make sure that if you are alternating, you're keeping a good tally of these things in case if you need to switch out and someone else is going to take over the medications, they kind of know exactly where you left off. So it's a little bit easier to continue the care. And then oftentimes, if it is something that's persisting, or if you have any questions or concerns, please, please, please do give us a call so that we can work out any questions and make sure that we get you on the best track to managing the fevers. Any thoughts, Dr. Castelblanco?
I agree with all that. So that's perfect. Yeah, alternating between the two is very helpful for higher fevers in particular. If you're not having fevers that are too high and one medication seems to be controlling it adequately, then that's okay too. It's okay to just use the Tylenol every 6 hours or use the Motrin every 6 hours if you feel like that is controlling the fevers. But again, a very good point to check the temperature with a thermometer before you give the medication. Also to keep track of where the fever is going. Are the fevers getting higher or are the fevers getting lower? Usually when kids are improving, they might still have a fever, but the height of the fever might start to become a little less, and you know that they are on the mend.
That's right.
So very good. Great. So our last question, when do we need to go to the ER?
Ooh, this is such a good question. And I feel like a lot of the questions we get when we're on call relates to that exact question. And I oftentimes, hear a number and parents want to know, is this the number I go to the ER? And I always tell parents, the number really isn't what bothers me. I would say yes. If you have a temperature that's above 105 and it's consistently reading above 105, I would say that might be my number where I would say you might want to consider going to the urgent care or getting seen. That would be a number if I were to look for a number. But most of the time, we don't get there. Most of the time, we have fevers that I would say the most important thing to look for would be, of course, how your child is doing. Is your child playing and active and running around? Even if they have a 104 fever, I'm happy to see that they're happy. And that's the most important thing is their level of activity and their mental status. If they're looking good, I'm happy. If they are lethargic at 99, not even a fever, or maybe at 100.4 and the child is lethargic and can't get out of bed, I'm more worried about that level. And then the next thing I watch for is, of course, if the child has dehydration. Of course, if your child can't take any fluids, is getting dehydrated, you're not seeing any urination or urinary output, I'm more worried than a particular number to watch for. And then the third thing I look for is respiratory status. So if your child is breathing comfortably and doing well, I would say that's not as concerning as a child with a low grade temperature who might be struggling to breathe. So those would be the main areas that I would be looking at to help me better determine, is this a fever that needs to be evaluated right away? And then lastly, when it comes to the number of days of fevers, I feel like that's also another part of the art of medicine. I think most doctors would agree 5 days or longer, you should be seen by a doctor. But for me, if I have a newborn with a single day of a fever, I want to see them right away. And I would say probably would want to call their pediatrician right away. So if you have an infant who's less than 1 month old, we want to make sure we get you in right away and get you seen right away. But if you have infants who are maybe 3 months or 6 months, I would say I still want to see them. Give me a call. Or if it's going on for a day, 2 days, we want to know. But for older kids, I would say, maybe 3 days, maybe 4 days. So always call your pediatrician to see how many days out do I need to bring my kid in to be seen, and at what age does it change? But a general rule of thumb, I would say most pediatricians, if you have a newborn who's under 1 month of age and has a fever, that's something that you don't want to go looking for your Tylenol or Motrin. You want to make sure that baby gets seen, and you want to give us a call as soon as you can. Otherwise, I would say for other age groups, the days a child can have fevers varies based on the provider. What would you say, Dr. Castelblanco?
Yeah, so Dr. Sepanian, I think I agree with everything you said. I will reiterate the less than 1 month fever should be evaluated right away. And that means you can definitely give us a call in the clinic or after hours. But if you don't get a response from us in a few minutes or in 10 minutes or something like that, the recommendation is going to be that you go directly to the emergency room, because less than 1 month old, like Dr. Sepanian mentioned, the babies need to be evaluated right away. They're little. They haven't really developed much of an immune system by that point. And if you call me, I'm going to tell you to go to the emergency room right
Yeah.
away. So you know what we're going to say. Try and go to your nearest emergency room. If you are able to get to an emergency room that has a pediatric department available in the hospital, that is a better option. So all emergency rooms will see babies with a fever. They will see all patients, all pediatric patients. But if you know of a hospital that has a pediatrics department and has pediatric specialists available, that is a better option if you have time and are able to get there. So in our community, that hospital would be the Tarzana Medical Center. They have a pediatrics department. If any specialist is needed, if a patient needs to be admitted to the hospital and stay overnight, then they have the capability of doing so at that same hospital. Of course, if you do not live close to a hospital that has that capability, any emergency department will do. And I agree, over a month old, we still want to know about it. We still want to see our patients, but at that point we have a little bit more time to really figure out, where's the fever coming from? Should you be seen in our office? Should you be seen in the emergency department if it sounds like something really concerning? And you know, the younger kids are, the more concerning a fever can be. But like we mentioned before, not the fever itself, but what the fever might indicate is going on. And little kids, babies in particular, can't tell us where it hurts or where they're struggling. And so that's why we need to take a look at them and figure out what's going on. So I think that we've covered most everything regarding pediatric fever that we wanted to talk about today. If there are, I'm sure, many more questions that we could really go into, but we have a limited amount of time, and this is meant to be a short overview of fever, not all inclusive. So please don't use this in lieu of a visit to your doctor's office or a phone call to your pediatrician, but please use this as a resource that maybe might answer some questions that you might have. So thank you for joining us. And again, like we've been saying, any further questions or concerns specific to your child, please reach out to your pediatrician, and they will definitely help you out.
Absolutely. Thank you so much. And we look forward to hearing from you and seeing your kids here in the office.
Great. And I think that we might be including a link to some pediatric resources as part of this video. So take a look at that. There will be some pediatric resources available through our Facey website, and the dosing charts for some of the medications that we've talked about today. Have a great day.
Thanks. Bye.